Good afternoon. So I'm Jeanine. I've been at Moffitt for about 5 years, focusing on GI nutrition for the past year or so. One little known fact about me that I don't share very frequently, but I figured it might be pertinent for today is that I am a cancer survivor as well. And I owe my health to Moffitt Cancer Center. Um, so, given my personal experience with chemotherapy and immunotherapy and surgeries, I'm really happy to give back to the community here and help patients through their treatment. So, my role here is to be your nutrition coach, your patient advocate, and your cheerleader, or whatever it is that you need. Um, the goal of the goal of gastric cancer and nutrition therapy is improved overall nutrition status, better metabolism, better tolerance of cancer therapies, and improved quality of life. There are many common symptoms of gastric cancer, and I put the most common ones here. So, a feeling of fullness, um, heartburn, nausea, vomiting, unexplained weight loss, loss of appetite, stomach pain, and fluid buildup. Of these symptoms, weight loss is very common. Weight loss is reported for 31 to 87% of patients at first diagnosis of malignancy. And actually 65 to 85% of gastric cancer patients are considered malnourished. Malnutrition is associated with increased morbidity and mortality, prolonged hospital stays, poor treatment tolerance, and a lower survival rate. Your dietitian can help with all of those things. Our role is to counsel patients on nutrition issues, and we promote health and help manage disease through healthy eating habits. When you meet with a dietitian, first we'll interpret your medical history, then we'll create a needs assessment to determine nutritional issues. We'll then make some goals. And lastly, we'll determine follow-up care. For some people, it could be weekly, and for other patients, there could be little to no follow-up care, depending on the specific case. As the team discussed earlier, treatment usually looks like surgery, chemotherapy, radiation, or sometimes clinical trials. So first, I'll discuss surgery. Typically, we see gastrectomy patients before, during, and after surgery. Let me go back for a second. So before surgery, we'll assess weight history. We'll consider early interventions if needed, like if somebody is very malnourished, they might need a feeding tube before surgery. We'll make a plan, just typically small, frequent meals throughout the day. And we'll set some short-term goals and some long-term goals. Short-term goal is almost always weight maintenance leading up to surgery. During a patient's hospital stay, they will usually start with a clear liquid diet with the goal to advance diet as tolerated. And if a feeding tube is placed at surgery, the goal is to advance to goal rate. Again, we still want weight maintenance. And it's also very important that we set up our outpatient nutrition appointment prior to discharge with the patient so that there's follow-up care in the outpatient setting. After surgery, your diet will look like 6 small meals a day. And at first, you may be able to tolerate only a half a cup of volume at a time. The goal is to build to 1 to 2 cups of solids or liquids at a time And this can take several months. A lot of times patients are very anxious to get back to normal, and the waiting of several months becomes a topic that we talk about a lot. It's important to eat slowly and chew food very well. We want to keep liquids and solids separated. Liquids can make you feel full quickly and impact the amount of food that you're actually taking in. After surgery, some patients can actually become lactose intolerant. So we usually try to have people bring back lactose containing foods, bring it back slowly into the diet to make sure that this is something you can tolerate post-surgery. We want to serve meals and snacks on small plates, like salad side plates, to avoid accidental overeating, since portion size is significantly different after surgery than it was before surgery. And lastly, it's important to sit upright while eating. We recommend including a protein with each meal and snack. I'll go over this more a little bit later, but high protein foods would be meats, fish, chicken, turkey, cheeses, dairy products like milk, yogurt, cottage cheese, and nut butters as well, like peanut butter or almond butter or something like that. After surgery, we want to avoid foods high in sugar. So anything with high fructose corn syrup is going to be probably considered high in sugar. A lot of your sweets and pastries and sodas and things like that are going to be very high sugar, which can lead to dumping syndrome. Along with that, sometimes Boost or Ensure can cause similar symptoms of dumping syndrome post-surgery. So it's important to know that going into it, that if you rely on products like Boost or Ensure now to keep your weight up, we might need to find a different alternative to prevent you from having dumping syndrome. So what is dumping syndrome? I listed some of the common symptoms of dumping syndrome here, being stomach cramping, sweating, rapid heartbeat, shakiness, hunger, nausea, diarrhea, most commonly diarrhea, and dizziness. And it typically occurs 15 to 30 minutes after eating, but it can occur 2 to 4 hours after eating. That would still be considered dumping syndrome. For total gastrectomy patients, tube feeding is typically the sole source of nutrition for the first 6 weeks after surgery. Usually, we use a product called Nutrin 1.5 or Nutrin 2.0 with a supplemental protein such as ProSource No Carb. Other products that we use here a lot, depending on food allergies or food intolerances, past medical history, would be Kate Farms products, another product called Peptamen, and then a supplemental nutrition of Banatrol, which can help with diarrhea as well. As you are able to eat more by mouth, that's when we can start to titrate down tube feeding. Outpatient nutrition appointments after surgery are usually pretty close together, usually every 1 to 2 weeks in this time period, just to make sure that we can titrate the tube feeding down at the same rate that you're eating more. So eventually we can get the tube out and just have a regular diet by mouth. After surgery, patients typically need a couple of supplements, the first one being a multivitamin. Chewable or liquid is best, with gummy being the hardest to absorb and digest. So we would recommend for the first 3 to 6 months doing a liquid or a chewable multivitamin. In terms of calcium, we're looking for 1,500 milligrams total per day. And B12, if you need it, would be 500 micrograms daily. I get a lot of questions in the GI clinic about is this food okay? Am I safe to eat this? Or what should I eat? So the next 3 slides are examples of these small little meals that you could have throughout the day. Most of these have a pretty good source of protein with them, and that's an important part of maintaining muscle mass. So you'll notice on the slides here, they're all going to be calorie dense. Most of them will be protein dense as well. So avocado or guacamole, which I have pictured there, um, cheese and crackers, cheesecake, cottage cheese, cream-based soups, egg, chicken, or tuna salad, and grilled cheese sandwich. So all of these foods would be things that once you're back on like a regular solid foods diet, these would be good because they're calorically dense. More snack ideas would be a half a bagel with cheese for protein, ham and cheese sandwich, hard boiled or deviled eggs are a good quick snack. Ice cream, if you can handle the sugar content. Instant breakfast drinks and liquid nutrition drinks, again, if you can handle the sugar content. Macaroni and cheese, macaroni salad, and milk, whether it's cow's milk or soy milk. Both of these are great sources of protein as well as calories. Milkshakes are another thing that we can consider if you can tolerate dairy and if you can tolerate the amount of sugar. That would be a quick way to get a lot of calories. Peanut butter and crackers, peanut butter and jelly is one of my favorites. Protein bar without nuts, scrambled eggs with cheese, and Greek yogurt, another really good one, contains natural probiotics and a good source of protein. Other than surgery, it's important to mention the nutrition guidelines for other forms of treatment. When it comes to chemotherapy and radiation, protein needs and calorie needs are increased. In order to meet those increased needs, it's a good idea to try to, again, eat small, frequent meals, so 5 to 6 small meals per day. It's easier to digest than 3 larger meals if we break food meals down into smaller amounts. For chemo and radiation, it's also important to try to eat foods that are rich in calories to prevent weight loss. So same thing with the snack ideas post-surgery. Again, we're trying to keep weight up. So we want nutrient-dense foods like avocados or full-fat dairy, something like that. There's a lot of nutrition issues that are common with chemo and radiation, but I'll review the 4 most common nutrition issues would be loss of appetite, nausea, vomiting, diarrhea, and I'm going to give you guys some tips for preventing dehydration. Loss of appetite is very common, especially with chemotherapy. So eating smaller, more frequent meals can help. Large meals can be overwhelming, and it's easier to digest the small meals. Choosing foods that are higher in calories and protein just to kind of get more calories packed into a small amount or a small volume would be best. And for a lot of patients, liquids are easier tolerated than solids. So getting some sort of oral nutrition supplement on board, like Boost or Ensure or Gain, or whatever it is that you prefer and you like. Or we could do homemade protein milkshakes or homemade protein smoothies, both with added protein powder added into this to make sure that you're getting a good quality product. And light exercise such as walking can help naturally stimulate your appetite. With nausea or vomiting, it's important to avoid high fat or greasy meals because that's going to make nausea worse. Small, frequent meals throughout the day, easier to digest. Kind of a common theme when it comes to nutrition and cancer is small, frequent meals throughout the day. Trying products that contain ginger can help, like ginger tea, ginger cookies, or ginger candies. Make sure you have a good anti-nausea medication on board and take it according to how your doctor has prescribed it. A lot of patients wait to take anti-nausea meds until it's the back end and now they're already nauseous when the doctor prescribes it on the front end. take it, as directed. We want to avoid foods that are high in fiber because that might slow down your digestion, making nausea or any GI symptoms worse. And avoid foods with strong smells or tastes, as that can also increase nausea. When it comes to diarrhea, it's really important to drink plenty of fluids. We want to replace the fluids that have been lost during diarrhea. We want to avoid foods that are greasy or high in fat because that can make diarrhea worse. We want to avoid foods that are high in fiber. That can increase your bowel movements. Examples of that would be salad, fresh fruit, or whole wheat products. Although these are all great from a nutrition standpoint, these are all great foods. If you're suffering from diarrhea as a side effect of your cancer treatment, it's best to kind of avoid those foods while symptomatic and bring them back on when you're feeling better. Eat smaller, more frequent meals throughout the day. You could check with your doctor to see if adding a soluble fiber supplement might help to thicken stools to make diarrhea better. So an example would be Metamucil or Benefiber. A lot of times sugar-free foods or sugar-free gum, they can make diarrhea worse. They can cause gas. So these are things I would avoid. A bland diet is a good idea until diarrhea resolves. So nothing spicy. And check with your doctor or dietitian if you're having continuous diarrhea or bowel movements increase in frequency after following these steps, because in theory, they should decrease. Preventing dehydration is a super important part of symptom management when it comes to chemo and radiation. Dehydration can cause symptoms such as nausea, vomiting, loss of appetite, feeling tired, dizziness, or rapid heartbeat. So for a lot of people, they're nauseous, they have a lack of appetite, and the dehydration exacerbates the problem and makes it worse. So step one is to become hydrated, and then maybe you're a little less nauseous, maybe your appetite comes back a little bit naturally. So usually step one when I'm counseling a patient is that we make sure that hydration status is good, because that's going to naturally fix some of the other problems that might be going on. Try to drink 8-ounce glasses of liquid every day for a total of 64 ounces. And it doesn't have to be just water. Of course, water's the most hydrating thing for you, but there are other things that we could substitute, especially if you're feeling super nauseous or water's just not doing it for you that day. We can include popsicles, sports drinks, milk, juice. Bone broth is a great one because it actually has some protein in it as well. Those would all count towards your fluid goal. To switch gears a little bit, I just wanted to kind of mention the survivorship diet. And this would be more for a patient who's kind of outside of that window of like immediate treatment. It's been a few years, they're feeling really good. That's when it's a good idea to kind of bring up survivorship diet. For us at Moffitt, that's the whole food plant-based diet. And the whole food plant-based diet has been shown to reduce risk of recurrence of cancer, reduce risk of second new cancer forming, reduce patients' risk of cardiovascular disease, type 2 diabetes, and kidney disease. All right. In 2018, the American Institute for Cancer Research released updated cancer prevention guidelines, which is what we base our survivorship diet on. And it's important to note that cancer prevention guidelines are also what we use for cancer survivors. Again, this is the diet that's going to help prevent you from becoming sick. So we want to make sure that this is what we follow. So cancer prevention guidelines, number one is be a healthy weight. For adults, that's a BMI range of 18.5 to 24.9. And older adults who are greater than 65 years old, the BMI range increases a little bit to 25 to 27. The second guideline here is to be physically active. to follow or exceed national guidelines, limit sedentary habits. Typically, I tell people 30 to 60 minutes of physical activity 5 days a week. The next guideline is to eat a diet rich in whole grains, vegetables, fruits, and beans. So again, this is a diet that we're probably not going to be able to do right in an immediate treatment process, but down the road, this is a diet we want to get to. This is a diet that's going to be healthy. This is going to be a diet that's going to be an integrative part of maintaining a healthy lifestyle. And this is a predominantly plant-based diet. We're going to limit consumption of red or processed meats, a moderate amount of red meat, which is red meat would be your beef, your pork, your lamb, and little, if any, processed meat, which would be bacon or sausage or hot dogs or anything like that. The next guideline would be don't use supplements for cancer prevention. Aim to meet nutrition needs through diet alone. The next guideline would be to limit consumption of fast foods and other processed foods that are high in fat, starches, and sugars. This is going to help control calorie intake and maintain a healthy weight, going back to point number 1 with the BMI. The next guideline is to limit alcohol consumption. And it's best not to drink alcohol. They do recommend that if you choose to drink alcohol, 1 drink a day for women and 2 drinks a day for men. And after a cancer diagnosis, follow these recommendations if you can. Again, it's labeled as cancer prevention, but this is what we recommend to cancer survivors as well. Some helpful resources that can be important to cancer survivors, just to get a little bit more information on nutrition. There's so much information on the web in terms of nutrition and cancer. So it's really important for me to talk to you guys about like reputable places to look for this information, so you don't accidentally put yourself down a rabbit hole of the internet. It's also important. I want to make sure that we talk about how to get a nutrition consult. So in order to do this, you can call us at 813-745-3609, or you can have your doctor put in a consult, which would generate the process to get you an outpatient nutrition appointment with myself or one of my colleagues.